insurance merger has federal regulators suing to stop it from happening. Aetna wants to buy Humana for $34 billion, while Blue Cross Blue Shield has proposed buying Cigna for $48 billion. Now, if the mergers move forward, customers would have two major insurance companies to choose from, and the federal government says the deals will increase health care costs and lower the quality of care. Joining us today to help sort all of this out for us is Carmen Balber, the new executive director with Consumer Watchdog out of Santa Monica. Thank you so much for joining us, Carmen. So tell us, how will this impact consumers?
Well, we've seen with the history of health insurance mergers that when companies merge, consumers pay more in premiums, their benefits are reduced, and their options fall.
Well, so the health insurers are saying, well, you know, if we are really large insurance companies, we can negotiate lower rates for medical care. We can negotiate better rates for pharmaceutical drugs. What do you say to that?
We're already talking about health insurance mega companies. So there is no doctor in California who can say no to Anthem, or very few, because they already have such huge market power. They don't need more.
Is there anything that would possibly prevent this merger from happening, do you think?
Absolutely. I think that the chances are the merger will be rejected. The U.S. Department of Justice, California Department of Insurance have said it's not a good deal for consumers. They've challenged it in court. Now Anthem is digging its heels in and is trying to get the deal to happen. But I think the circumstances are pretty strong that this will not go through, which is a very good thing for consumers.
Any idea when you think this will find out if this merger will not go through? I mean, obviously, this is sort of one of those slow sort of things from happening, but.
Absolutely. You know, Anthem has already filed their challenge in court, but you know, court cases drag on. We expect Aetna to do the same thing, so this could drag on for a very long time. The good news is that for now, that means the status quo for consumers, at least as good as the status quo is.
So when we have our open enrollment for health insurance, we really don't have, it's not going to affect us right now.
I don't think that there is any chance, or very little chance, that it will be resolved before open enrollment, which begins November 1. So consumers will be safe until then.
And then, Carmen, another big headline right now is Covered California. The rates are going up. Why, and how much are they actually going up?
So this is a big shock for California consumers. Rates are going up for Covered California an average of 13%. And for some of the health insurance companies, Blue Shield is the top one, 28% is the highest rate increase. Huge increases, and we see this because California is one of the few states in the country where health insurance regulators can't say no to an excessive rate increase. Insurers can impose what they want.
All right, well, still so much I'm sure we'll see you in the coming months, but thank you again for joining us right now. Carmen Balber with the Consumer Watchdog Group, thank you again. Coming up.